Hello everyone, I'm here again. I'm Dr. Mary Joseph A. Mercadel. I'm a cardiologist and an electrophysiologist. In my previous videos, I have discussed with you some heart rhythm disorders and the electrical conduction of the heart. Today, I will be discussing with you again some cardiac dysrhythmias that require implantation of permanent pacemakers. Okay, so let me just review with you the electrical conduction system of the heart. As you can see, this is the cross section of the heart. Imagine that there is an electrical conduction around it, and it starts from the sino-arterial node or the natural pacemaker of the heart. From the sinus node, the electrical impulse goes into the atria. It depolarizes the atria. Then it goes to the AV node, then the bundle of His, then the right bundle branch, the left bundle branch, and then the Purkinje fibers that makes the heart contract. Okay, so this is the normal electrical conduction of the heart. What if something happens or there is a dysfunction in certain areas of this conduction system? For example, if there is a dysfunction of the sinus node, which is the normal pacemaker of the heart, that normally beats between 60 to 100 beats per minute. Okay, so if there is sinus node dysfunction, this sinus node or the natural pacemaker of the heart becomes slow, or it beats less than 60 to 100 beats per minute, and sometimes it is slow enough, less than 40 beats per minute, that makes the patient have certain symptoms like syncope, pre-syncope, or even shortness of breath. And in the Holter, you might see that as pauses, which is more than 3 seconds, and heart rate less than 40 during waking hours. And this, plus the symptoms, are indications to implant a permanent pacemaker like this one. Okay, this is an example of a permanent pacemaker, the battery, which we implant to pacemakers with dysfunctions of the sinus node, like a very significant bradycardia accompanied by symptoms. Okay, so we put a lead on the right atrium, and then we put a lead on the right ventricle. We call that dual chamber pacemaker, and then we connect these leads to the battery, and then we put this battery under the skin, or we call pocket, and then we suture that. And that's a simple way of describing the way of implanting a permanent pacemaker. Okay, so another indication. What are other indications of implanting a permanent pacemaker? Another one, if there is another dysfunction in another system, which is called the AV node. If you have a patient that has AV block, and these are certain degrees, the first degree AV block, second degree AV block, or the third degree AV block. Most of these patients also complain of shortness of breath, syncope, pre-syncope, or sometimes even chest pain. And in the Holter, you will see that these patients also have heart rate of less than 40 beats per minute during waking hours, and they can also have pauses, which is more than 3 seconds. And you can see the AV block. Okay, so usually third degree AV block or second degree AV block, which is Mobitz type 2. In my future videos, I will be discussing with you how to recognize such rhythms. Okay, so if you have this, you have indication to implant a permanent pacemaker. It can be a dual chamber with the right atrium here, right atrial lead, right ventricular lead, which we call a dual chamber pacemaker, or a single chamber lead, which has a lead in the right ventricle or just the atrium. Okay, so those are the types of pacemaker. Sometimes we also have some patients post MI with ejection fraction less than 30% and has certain cardiac arrhythmias like ventricular tachycardia or ventricular fibrillation that makes them have risk for sudden cardiac death. And those patients now require an implantable cardioverter defibrillator, or what we call AICD, like this one. And we put this also the same way. We put a lead on the right ventricle, and then we connect the lead to the ICD, and then we put the battery under the skin. We suture that, and then we test the threshold. We test that for certain functions so that the pacemaker will be safe, and then we program that to deliver shocks to the patient if the pacemaker detects ventricular tachycardia or ventricular fibrillation. And after we implant these devices, it doesn't end at that. We have to monitor our patients. We have to make sure that what we have implanted have normal function, or functions normally: the battery, the sensing, and the capture. So we use this, what you call a programmer, which we use to monitor our patients. Using this one, we can check the battery, we can check the threshold, the sensing, and we can adjust the parameters of the pacemakers and the ICD. Alright guys, so you have now a certain idea about pacemakers, ICDs, and I hope you have some inputs too that you can tell me, so I can explain it to you. And in my future videos, I will be discussing more about those disorders that you want me, heart rhythm disorders or arrhythmias that you want me to discuss. Thank you very much. Thank you, and please don't forget to like and subscribe.